Hi, I'm Tracy Wakefield. I am the inpatient neurology nurse practitioner here at St. Francis, and I am very excited to get a chance to talk to you this month for Stroke Month, because the month of May is Stroke Month. We will be talking about stroke for the next few minutes, and one of the things that I want to make sure people know about are common risk factors. And the risk factors for stroke include diabetes, hypertension, obesity, sleep apnea, hyperlipidemia or high cholesterol, a history of atrial fibrillation, and tobacco and alcohol use. Now, these are the common risk factors, but they are not all of the risk factors. But we're going to talk in a little bit about ways to reduce your risk factors for stroke. So the main way that we want people to think of stroke and when they're having strokes is using the BFAST system. Now, the BFAST system looks at kind of all of the areas of the brain and where the strokes can occur. So the first part is balance. About 20% of strokes present with balance issues, and it's just not something that is not widely known. And that can also include headache and dizziness. The next letter is E for eyes, and that's visual changes, blurred vision. Sometimes people will report that all of a sudden they feel like they're in a tunnel or they can't see out of one eye. That's a really significant change. Now, the most obvious change, though, is the F for face. Most people are really good about thinking about their face and facial droops, and so it may look just sort of like one side of the face is just sliding down their body. The A in BFAST is for arms, and that is weakness in the arms, and sometimes it's big weakness, and sometimes it's just a little tiny bit. But any weakness in the arms or the legs is a significant stroke symptom, and you need to come in. Next is speech. And typically people think of slurred speech for this, but it really could be just trouble finding the right word. It could be nonsensical speech, or it could be slurred. And then time. Time, if you think that you are having stroke symptoms, you need to come in immediately. And the reason for that is that people who present within 4 hours of, or 4 to 4.5 hours of their onset of symptoms, so when their symptoms start, can sometimes receive a medication that really has a great impact on relieving those symptoms. Patients who come in and receive that medication tend to have much better outcomes. But you need to come in, and you need to come in to a verified stroke center. Here at Bon Secours, all of our facilities are verified stroke centers. Now, again, early arrival equals best outcome. I think, from my experience caring for stroke patients, what happens is that people are having these symptoms, and they kind of are in denial. They kind of write it off, and they think, oh, strokes are terrible. So they are looking for those really dramatic strokes. But it's these subtle strokes that people have initially that really can make them quite ill. Now, once you have a stroke, though, all efforts really turn towards prevention, because having a history of stroke puts you at risk for a second stroke. So again, if you have a stroke and you come in, we're going to treat you right away to try to help you with your current stroke. But then we're going to really sit down and look at those risk factors and see how we can help you. One of, or as I go out into the community and talk to people, I am asked all the time, how can I reduce my risk factors of stroke? What medication can I take? What's the latest this? What's the latest that? And while it's an exciting time to work with stroke patients, in reality, it's the basics that decrease your stroke risk, and it's things like exercise and stress reduction. Exercise will help you reduce every single stroke risk. So again, and then the next question I get asked is, how much exercise do I need? And the answer is that you need 30 minutes 5 times a week. And you shouldn't, when you're exercising, you shouldn't feel like you are, like you can't breathe. You should be able to walk, or you should be walking at a pace where you can talk and carry on a conversation, but you shouldn't be able to sing. So that is a different speed for everybody, but that really is sort of the marker for how hard you need to be. For those that can't walk, swimming is a great idea. For those that don't like to swim, a lot of my patients who have joint troubles really get a lot of benefit from just walking in the pool. Again, 30 minutes, 5 times a week at a speed where you can talk but not sing. But that by itself is really not enough. The other thing that we really need to do is we need to focus on building muscles. Muscle strength, one, helps our bone health, but it also helps with weight control. It helps with blood vessel strength. And so that can be any kind of strength training. You can be lifting cans while you walk, just little arm curls, push-ups, sit-ups, or you can, if you really wanted to, could go to your gym and work with a trainer on strength training. You just need a little bit, and again, it should never hurt. You should just feel fatigue, but not exhaustion, and never pain. Again, strength training, and the benefits of cardiovascular training, again, is increased health. And then it takes me to my next point, which is that exercise really helps with anxiety and stress. There is a link between stress levels and cardiovascular health. So patients who are undergoing a lot of stress actually can have strokes. You see that actually all the time when you see kind of broken heart syndrome. Those are the people that, again, maybe their husband died or are undergoing some kind of terrible life event and then end up having either a heart attack or stroke. And that's, again, that is the direct link. So what can you do to control stress? Well, first you have to understand what stress is. And so stress is your body's natural fight or flight symptom. So going back, it increases your heart rate and it increases your blood pressure and it gets you ready to run. But most of the time now, we don't need to run. What we need to do is to sit down and take a breath and relax. And so the easiest way that I tell people to immediately break that high heart rate, high blood pressure stress cycle is to just take a minute and take a breath. And just take a breath for 2 or 3 breaths and really focus on relaxing your face and your jaw. You, again, just take seconds. You can do it anywhere. It's not obvious what you're doing, but it immediately brings down your heart rate, immediately brings down your blood pressure. Now, for long-term stress, though, you got to kind of treat the cause. And so, again, that's when exercise can really help. Talking to family members can help. Laughing can help. Sometimes we just need to see a funny movie, or we need to talk to that coworker that makes you laugh. Laughter is hugely helpful. Now, for those that need to be a little bit more serious, you can actually meditate. And meditation, again, it really just focuses on the breath. Some people, when they think about meditation, think about the Swami in England with the prayer bowls. Doesn't have to be that fancy at all. It's just taking a moment to focus on your breathing. If you can close your eyes, that's wonderful. But if all you can do is breathe, you're just quieting the soul and centering the body. Now, a more formal way of stress management, or a more active way, is yoga. Now you do have to be careful with yoga as there's many different types. Some of them are very relaxing, but some of them can be quite strenuous. And so what I am talking about as far as stress control is the gentle yogas. At my gym, they call it chair yoga, they call it yoga for relaxation, and those can be very beneficial for stress management. Yoga is recommended by the National Institute of Health and the American Heart Association. Yoga really involves putting the body into very specific postures and poses and holding those while breathing deeply. And yoga has been found to really be very helpful with depression. Now, as people get more comfortable with their yoga practices, they actually can move into some of the more aggressive ones, which may help with strength training. So, lots of information quickly, but I thank you for your time, and I thank you for listening to me talk about stroke. Stroke is something that I'm very passionate. I'm very excited to care for these patients. Please remember your BFAST symptoms, and I hope that you can join the Bon Secours team on May 31st at the Richmond Convention Center for Jazz Up Your Health. And this is an annual program that we have in collaboration with the American Heart Association. You can come and you can learn more about exercise and meditation, but there's many other things going on there. So you may learn about healthful eating or blood pressure control. So we thank you so much for your time. And are there any questions?
There are no questions right now.
Okay.
So thank you.